My name is Debra Harvey, and I kind of put a little introduction. Did I give? Oh, okay. About myself, I work at Pontiac General Hospital by day or through the week, and on the weekend, I work as a Reiki master practitioner and teacher. I have my own. I found my own nonprofit organization, Healing with the Twist, and it's kind of really just getting started, but that's what we do. We train people in different energy work, healing work. So I want to talk about Reiki, and I'm not going to go through all this. You could just read it about about. I mean, this part, like about myself, or should I read it? Should I read it?
It's up to you.
Okay. Well, I'll just go through it real quick. Um, so I said I work as a Reiki master practitioner, and I'm also a member of the International Center for Reiki Training, and it's kind of like all over the world. And member of International Association of Reiki Professionals. So I just started with the new owners at Pontiac General. I just got permission to start teaching and certifying people at the hospital. So far I've certified 2 RNs, and they're level 1 Reiki practitioners. And so I've always had a strong interest in integrative medicine and spiritual healing, meditation, energy work, and all that. That's just like from childhood. So in the 90s, I just started studying everything I could, kind of going more in a formal way of just taking classes and everywhere I could, University of Metaphysical Science and just different places, and kind of really got into Reiki and just began to see how beneficial it was to everything, every living thing, not just people. So that's what I'm going to speak about today. This is new for me, like speaking for a medical facility is new. I usually go around. I've spoken at like schools and just in general at holistic fairs and things like that. So the medical, just integrating it with what I do as a profession, this is just bringing it into the medical. I'm excited about this. Like I'm nervous because I'm really just so excited. I really am. This is awesome to me, and that you guys open up to this. So awesome. Okay, we're gonna start talking about what Reiki is, and it's spelled Reiki. It's pronounced Reiki. It is a form of energy healing, and it's kind of listed scientifically under biofield healing. So what is happening is the Reiki practitioner, there's an attunement process to become a Reiki practitioner. It's not like other learning, other healing modalities. This one, the Reiki master actually attunes the student, opens up their channels is what's happening. And it's called an initiation, but opens up their energy channels to receive the energy and be able to transfer it to any other living thing. And it's considered a hands-on, like laying of hands type healing or treatment. So integrating it into the hospital. Let me start with this. Let's see if I can do this. Okay. The overview. I'm gonna talk about what Reiki is and actually what it's not, which is kind of important. Its actions, the science of Reiki, a little bit. The organization that I'm a part of, we're kind of pioneering this. It's called a touchstone project, where we are actually trying to gather actual data on how this particular modality really is helping people. instead of just people saying, oh yeah, it was good, I liked it, and that type of thing. We're trying to actually make it, put it together, so we're getting medical people involved in the research. It's a research program. Uh, then I'm gonna talk about the hospital. There are a lot of hospitals now that actually are integrating Reiki into their healthcare settings. And then I want to talk about like the benefits of that for the patients, for the staff, for the corporation in general. And also at the end, there'll be some like resources, and it'll be some things. I have some handouts if anybody wanted to go and maybe study further about it. Okay. So it's an ancient Japanese healing practice developed by Dr. Mikao Usui, but there is a lot of theory that it reaches back into the beginning of humankind, that it's that ancient. This doctor basically brought it back to the forefront in the late 1800s and the early 1900s. So you see it involves hands-on touch, which is in the transferring of ki, which is a form of energy. In different cultures, ki is called different things. And it strengthens the person's own ability to heal. So it's not like we're really healing them. We're strengthening their immune system so that they will heal themselves or assist in healing themselves. And so down there you see it's categorized as biofield therapy, which means that the field around the body is what you're really integrating with, is the energy around the person, because that's usually where illness starts before it manifests physically. And it's important to know what it's not, because this gets kind of mixed up a little bit. It is not a religion. It is not faith-based. It's not a cult. It's not invasive. It's not intrusive. It's very safe. It can't harm because you're using the natural energy in the world that's available to everyone. So you don't have to have any type of belief systems or anything to use this therapy. That's a kind of a sample of a Reiki session where it starts. Usually they start with the head, laying on the hands. It can be done without even touching people. You don't have to touch them. Actually, you don't even have to be in the room with them as you begin to learn how to use it. You don't even have to be in the same state, if that makes sense, really. Or country, okay. And they remain fully clothed, and it usually lasts typically like an hour. That says several minutes, but that's in emergencies. There are some times where the person comes into an emergency and it may be a few minutes. And this tells about some of the facility, how many people are really using this. A lot of people, particularly I noticed the West Coast is really, really big into Reiki. And this talks about some of the studies, and I kind of didn't want to get into this. I didn't really tweak the PowerPoint the way I wanted to, but it kind of gives an example of some of the conditions that are being tested. But this is an old PowerPoint, so updated to now, because it did show that it wasn't really treating fibromyalgia, but we do have data now that it's really good for fibromyalgia. Like, it really does reduce pain. And the thought or the idea prior to this was that when it was showing that it wasn't as effective for fibromyalgia was because the person, a lot of people with fibromyalgia are so kind of used to their pain and their medication and that type of thing that they just internally didn't, refuse the energy, so to speak, because they just like, or even if they felt it, they just weren't going to say it. So it was kind of very difficult to. So I'm going to talk a little bit about the science of Reiki. This is the Touchstone project that I'm a part of, and we're using we have documentations where we're using what the patients are telling us to kind of rate how Reiki works for certain types of conditions. But we also are testing actual test results that's coming back after sessions. So we're seeing a lot of things like significant, like stroke patients actually getting better in a short amount of time, incisions healing quicker post-op, things like that, things that we can actually measure. So we're working a lot with that now. And this is kind of a little bit about that, where it kind of breaks down different. But like I said, this is a little bit old, and we're coming out with more data. So this is kind of, especially that first one, doesn't really apply anymore because it really is effective for fibromyalgia. It may take more treatments, but it is effective. And then we have stroke, and we're also finding that it's really helpful with multiple sclerosis and helping people manage it, help them be more stable, help them have a better quality of life, a better outlook about life, which would kind of apply to the end, depression and stress, which happens to be with a lot of multiple sclerosis patients. So we are working a lot with them. And I've also noticed, if I might put in here, I work in the surgical department, and I have noticed that it lowering blood pressures post-op and pre-op, and less need for pain medication post-op, that type of thing. I mean, that I'm literally seeing, especially as, like I said, my hospital is kind of opening up to it, so I can kind of use it. And this is kind of what I talked about. We're doing more studies. And medicine and science is so right now interested in this. Like they're just jumping all over this, trying to understand it and use it because they just know that it's working. And so now they want to investigate it and research it. And so it's a lot of research right now about Reiki. Oh, wait, let's go back. Okay, so I'm going to talk about Reiki's potential as an offering in the hospital setting. So one of the things that we're finding that's good about bringing it into the hospital setting is that for the clients and the patients is that it does help them feel more in control of their own care. They're a part of it. They can say, yes, I want it, no, I don't, and it just builds a rapport. They begin to feel comfortable with you. They can feel your energy, and it's a different type of connection with them. And also for the caregiver, it is too. It's a different kind. It's a really I want to say intimate connection with your patient. So these are some of the facilities that offer Reiki in different ways. Like some of them offer it voluntary. Some of them it can be integrated into their care. Some of them offer it to the clients and the staff, and some of them offer it to the clients, the family, and the staff. So it's different types. Some of them do it, it's for free, and some charge. And that's another thing that the organization is working on is with the Touchstone project. As we move on, that we'll be able to get it to the point where insurance will cover it. So we need actually we need that data to prove this is helping patients, so we can move along with that. Okay, incorporating Reiki practice for fast-paced healthcare environments to reduce stress, anxiety, and pain in patients and caregivers. Continued exploration of self-care with Reiki, comfort, palliative, and hospice care are really open. That's number 3. They are really open to it. Hospice and palliative care. For patients, it reduces stress and anxiety, promotes feeling of control and engagement in their own well-being, promotes trust between patient and caregivers. Additive benefit to conventional drugs, therapies, potentially allowing reduced medication, fewer side effects and toxicities. For caregivers, reduction of stress burnout, promoting positive well-being, sense of competence. And I believe later in this PowerPoint it may show that, but if not, what they're noticing, the facilities who have integrated Reiki are noticing that they're having less call-ins from the staff. They're saving money on benefits and they're having less turnover because the staff appears to stay more healthy and have a more positive outlook about things. And for the patient, they're noticing that they're, like I said earlier, they're healing quicker, so they're in the hospital for shorter lengths of time. And what they're being given through the hospital is working better with the integration. Oh, there it is. Reduction in patient stay in hospitals, fewer complications, reduction in turnover, reduction in invasive procedures, and destination of choice for elective procedures. So for the hospital, the facility is beneficial in that way because patients want to come back. They're telling people, oh, you can go there to this place and you get whatever medication, whatever other treatment you're getting, and then you get this this thing where people lay their hands on you, and and so it's like that put together. And even if they don't understand it, all they know is that they felt it, or they felt calm, or they felt relaxed, or whatever feelings they have after the session. Some of the positive things I've seen, this is from actually not me, but you can see from Central State Medical Center, and can attest to, includes headaches that have disappeared and pain that has subsided after Reiki sessions. I've had patients tell me they are not completely at rest and have no worries. And I actually have seen and heard so much more than that, what they'll say after they get a session. For example, there may be patients on blood pressure medicine, hard to control hypertension, and they've been trying all these different medications, and the doctor put them on one and put them on another, and then they began getting Reiki treatments, and they only need one pill all of a sudden because the pressure will drop too low with all the other stuff, and all of a sudden it's controlled. So it's that, I've literally seen so many things. Observation from current practitioners. And this is William Lee Rand, who was my Reiki master, and he is the founder of the International Center for Reiki Training. According to hospital-based research and interviews with physicians and nurses, Reiki reduces pain, stress, anxiety, and nausea, improves sleep, reduces unwanted effects from medication and other medical procedures, and accelerates recovery from surgery. So, as you can see, it's really awesome for like cancer patients for side effects from chemo, that type of thing. Example of successful program growth. And this just kind of shows a graph. And I'm going to skip that because we kind of talked about that with the different relaxation. But these are graphs on how it improved people's sleep and improved their nausea. And this is part of the Touchstone project and how we kind of graphed it out, how the client or patient was prior to the treatment and then after and what they're saying. And this is the same type of graph, but it's pertaining to the employees at Hartford. So you can see where pre is the green, and you can see where their stress levels were and pain levels were prior to a session, and then after a session how it was reduced, which is the blue, post Reiki. And these are just, this is still Hartford, and where they asked the patients like about future admissions and would they come back and that type of thing. This is just one facility, but we've actually studied a lot of facilities. It's very, very similar results in all of them. So as you can see, they're more likely to go back. And this is kind of what we just talked about, but in just a different way. And this is types of programs that are integrated into facilities. Some facilities, like the Dana-Farber Cancer Institute, is run by the hospital staff. So when it says that, they're training their staff to be Reiki practitioners. And they also, if some of them train their staff, and some bring in an outside person or outside Reiki master to train people or to actually do the Reiki. Some are contracted to a Reiki group that comes in and do it. So it's different types. And then some of them, like I said, fee is charged. Some have no fees, and most facilities do not charge for it. But this just to give you an example of some really well-known facilities that are using this, and this was like 8 years ago. So it's really increased since then. It's many more. And this is what we're thinking future areas will really expand to. It's really big in hospice already. Home care, the nursing facilities. Prenatal is really getting on board with this of having the mothers to receive Reiki prior to birth, and also we're even doing studies on the effect of the fetus, how it's positive for the fetus prior to birth, and where the birth is less stressful during the birth process for the fetus, for the baby. Rehab facilities, mental health facilities, and detention facilities. And particularly in detention facilities, we've seen it decrease aggressiveness, like dramatically. It decreases depression, it decreases, so it's used a lot in detention facilities with inmates that are really aggressive or angry, that type of thing. And we'll put it all together. Client base is patient, staffs, community, children, specific conditions like cancer, maternity, and surgical. I work a lot with children too. Children are really receptive, and they learn to do this really easy. So I have trained some children, quite a few children. Practitioner level, there are 3 to 4 levels. It depends on who's actually doing the teaching. So there's a level 1, level 2, level 3, but sometimes some Reiki masters will do level 3, which is advanced, but they want you to go to another level if you want to be a teacher. So it comes out to 4 levels. And then business model, volunteer versus paid, free versus revenue generating, and initial scale of offering 10 practitioners to 100 patients. In locations, clinics, hospitals, outpatient, scope of offering, practice versus teaching or both. So some facilities just have practitioners come in. They don't offer teaching or classes. Some do both. Some offer teaching. Department chair, CFO, etc. Community health outcomes, professionals, physicians, nurses. Metric definitions, length of stay, repeat visits, pain med use, and time of recovery, and other things. Resources for starting a Reiki-based program. I don't know if you all wanted to hear this. This might be, but this is if someone was really interested in starting a Reiki-based program. So I have some little websites you could go to about these things. And I have some handouts too. The Center for Reiki Research, including Reiki in hospitals. Reiki is a method of stress reduction that also promotes healing. It is administered by laying on of hands. Lay practitioners have used it for more than 90 years, and it's popular. But like I said, the idea is that it goes back forever. And the popularity is growing now. The study in 2007 by the National Health Interview Survey indicates that and this was in 2007, 1.2 million adults and 161,000 children received 1 or more sessions of energy healing therapy, such as Reiki, in the previous year. According to the American Hospital Association in 2007, 15% or over 800 American hospitals offered Reiki as part of their hospital services. Curated database. Oh, well, we'll just go to the next one. Thank you for having me.